Hello everyone, welcome you in my YouTube channel. I am Dr. Mohammad Sirajul Faisi. Today in this video, I am going to talk about drugs and their classifications. What is drugs? So drugs are chemicals of low molecular masses. These interact with the macromolecular targets and produce a biological response. When the biological response is therapeutic and useful, these chemicals are called medicines and are used in the diagnosis, prevention, and treatment of disease. Most of drugs used as medicine are potential poisons. If taken in doses higher than those recommended, use of chemicals for therapeutic effect is called chemotherapy. Drugs can be classified mainly on criteria given below on the basis of pharmacological effect. This classification is based on the pharmacological effect of drugs. It is useful for doctors because it provides them the full range of drugs available for the treatment of a particular type of problem. For example, analgesic have pain killing effect, antiseptic kill or arrest the growth of microorganisms. On the basis of drug actions, it is based on the actions of a drug, a particular biochemical process. For example, all antihistamines inhibit the actions of the compounds. Histamines, which causes inflammations in the body, there are various ways in which actions of histamines can be blocked. You will learn in details in next video. On the basis of chemical structure, it is based on the chemical structure of the drug. Drug classified in this way share common structural features and often have similar pharmacological activity. For example, sulfonamides have a common structural feature. You see, this is a structural feature of sulfonamide. This is a structure. On the basis of molecular target, drugs usually interact with the biomolecules such as carbohydrate, lipids, proteins, and nucleic acid. These are called target molecules or drug target. Drug possessing some common structural features may have the same mechanism of actions on target. The classification based on molecular target is the most useful classification for medicinal chemistry. So, drug target interactions. Macromolecules of biological origin perform various functions in the body. For example, protein which perform the role of biological catalyst in the body are called enzymes, and those which are crucial to the communication system in the body are called receptors. Carrier proteins carry polar molecules across the cell membrane. Nucleic acid have the coded genetic information for the cell. Lipids and carbohydrate are a structural part of the cell membrane. We shall explain drug target interactions with the examples of enzyme and receptors. So, enzyme as a drug target, catalytic action of enzyme. For understanding the interactions between drug and enzyme, it is important to know how do enzyme catalyze the reactions. The first functions of enzyme to hold the substrate for a chemical reaction. Active site of enzyme hold the substance molecules in a suitable position so that can be attacked by the reagent effectively. Substrates bind to the active site of the enzyme through a variety of interactions such as ionic bonding, hydrogen bonding, van der Waals interactions or dipole-dipole interactions. So look at this picture. This is enzyme and this is active site. This is substrates. Now enzyme holding substrates. The second functions of enzyme is to provide functional groups that will attack the substrates and carry out chemical reactions. Now, drug enzyme interaction. Drug inhibit any of above mentioned activities of enzyme. These can block the binding site of enzyme and prevent the binding of substrates, or can inhibit the catalytic activity of enzyme. Such drugs are called enzyme inhibitors. Drug inhibits the attachment of substrate on active site of enzyme in two different ways. Drug complete with the natural substrate for their attachment on the active site of enzyme. Such drugs are called competitive inhibitors. Look at this pictorial diagram. This is enzyme active site, this is drug, and this is substrate. Drug and substrate competing for the active site enzymes. Now you see drug bind to but substrate not. Drug block the active site of the enzyme. Now in some drugs do not bind to the enzyme active site. These bind to a different site of enzyme we call allosteric site. This binding of inhibitor at the allosteric site, you see this is the allosteric site. This is the active site, but this is the allosteric site. This is inhibitors inhibiting the occupying the allosteric site. If the bond formed between the enzyme and inhibitor is a strong covalent and cannot be broken easily, then enzyme is blocked permanently. The body then degrades the enzyme inhibitor complex and synthesizes the new enzymes. So friends, hope this video will be helpful to you. If you like this video, then subscribe my channel, and thanks for watching.